2020 Employee Training, COVID-19 Worker Health and Safety, effective September 4th, 2020. Module 3, Health Monitoring. Module 3, Health Monitoring. This module will review tests and outbreak management, including what to do if a student or staff member receives symptoms of COVID-19, what to do if a student or staff member tests positive to COVID-19, what testing protocols will be needed to put in place at your schools, and all school staff must receive training on outbreak management procedures. Overview. Educators are likely thinking about the following questions. What happens when a student tests positive to COVID-19? What testing protocols need to be in place? How can a COVID-19 outbreak be limited? And what happens if a staff member tests positive? What are the key things I need to know this year? Any student or staff member who develops COVID-19 symptoms must be immediately separated from the others in a closed isolation room until they are able to go home and should not take student or public transportation. The risk of severe health outcomes is not the same for all workers. The risk increases with age and is higher for people with certain medical conditions. If any student or staff member develops COVID-19 symptoms, the following must take place. Isolated students should be monitored per usual school policy, with physical distancing maintained and PPE provided consistent with health guidance. Following their departure, the room must be fully cleaned and disinfected. Staff and/or students, parents, or guardians of children with symptoms should be directed to use the online self-assessment tool and follow the directions. This tool provides a list of assessment centers. Those who test positive may not return to school until they are cleared by public health, and persons who test negative can return once they are symptom-free for 24 hours, unless they have been directed to self-isolate, such as if they have been in close contact with a case of COVID-19. Wellness Room / COVID-19 Response Management Protocol, also known as the Isolation Room Protocol. The board's protocol provides guidance to school administrators, managers, or supervisors in the event of a student, staff member, or authorized visitor presents with symptoms consistent with COVID-19 or reports a probable or confirmed diagnosis of COVID-19 while attending our school or board facilities. COVID-19 Response Management Protocol for the Wellness Room. There's a protocol for this. It has attachments which include managing a suspected or confirmed COVID-19 case in a school, managing students with COVID-19 symptoms at school, instructions for staff, and COVID-19 Wellness Room Protocol. What are key things I need to know this year? Where an individual is suspected of having COVID-19 at school, identify areas that may require cleaning plus disinfection. Items used by the individual in all surfaces within 2 meters of that ill person versus cleaning alone, such as a hallway or room where the individual passed through. Use disposable cleaning equipment such as disposable wipes where possible. What will this look like in schools? School reports on a daily basis on suspected or confirmed cases within the school community to the ministry. This report will not include the personal information of any individual. Communication with the school community is consistent with ministry guidance and relevant privacy legislation. There is a dedicated contact at the local public health unit and a list of the locations of the closest COVID-19 assessment centers or sites. At least one wellness isolation room is identified for any student or staff member that develops COVID-19 symptoms, and PPE must be available in that room. If possible, the isolation room should be in a low traffic area of the school. What will this look like in the schools? Schools must immediately report any suspected or confirmed cases of COVID-19 within the school to the local public health unit and provide any materials, for example, daily attendance and transportation records, to public health officials to support case management and contact tracing and other activities in accordance with all applicable legislation, including the Municipal Freedom, Information, and Protection of Privacy Act. Public health officials will determine any additional steps required, including but not limited to declaration of an outbreak and closure of classes and/or schools. School boards must report on a daily basis any suspected or confirmed cases within the school community to the ministry. Staff are required by Occupational Health and Safety Act to report any circumstances in the workplace that is likely to be hazardous to the health or safety of employees in the workplace. Reporting requirements. If Upper Canada District School Board is advised that one of its workers has tested positive for COVID-19 due to the exposure at the workplace, or that a claim has been filed with Workers' Safety Insurance Board, WSIB, the board will give notice in writing within 4 days to the Ministry of Labor, Training, Skills and Development, the Workplace's Joint Health and Safety Committee, and/or Occupational Health and Safety Representative, if applicable. Additionally, you must report any occupationally acquired illnesses to WSIB within 3 days of receiving notification of the illness. This is the end of module number 3.